Dr. Weber, how are cardiovascular outcomes, especially those downstream from initial cardiometabolic conditions, affected by the current challenges and gaps in patient care? I mean, non-adherence, social stigma, lack of support, treatment accessibility and affordability, limitations in pharmacotherapeutic management.
It's gotten quite difficult at times to do everything that we'd like to do for our patients. And there's no question that economic, logistic issues do play a major part in how seriously or how deeply and carefully we can treat risk factors, very often even in people who really have major problems. The cost of treatment sometimes is an impediment. We're not allowed to prescribe the optimal diagnostic tests we'd like to do, or there are limits put on the drugs that we can prescribe. Sometimes patients can't even afford to travel to see the doctor as often as they ought to. And there are many people, including professionals, which I find fascinating, but many people, many patients, who practice denial very effectively. You tell them, your heart is at risk, your kidneys are at risk, we worry that you might have a stroke, all sorts of things that ought to make people very serious about pursuing their care. And yet it's amazing how they miss appointments. I know that when we schedule clinic visits, and this is not just my institution, everyone who runs clinics in large hospitals will tell you, if you want 20 people to come to a clinic, you have to schedule 30 or 40 because so many people just don't come. Why is that? And it's not that they're not knowledgeable, it's not that you haven't told them what's going on, it's not that they can't even afford to receive the treatment you want to give them. There is something that makes people somewhat disinterested, or perhaps, again, to use that word, deny the fact that they really do have major issues. But it's interesting at the same time that people who do surveys of patients who have these problems, and the ones who are really aware of them, have been surprised at how profoundly people worry about their diagnosis. There was a recent survey published that showed that people with high blood pressure, and particularly when their blood pressure couldn't be well controlled by the doctor, that these patients actually developed a great deal of anxiety and concern. They really worried that life events perhaps could put stress on them and make them very vulnerable to having a stroke or a heart attack or some other very serious event. So there is a whole spectrum of response to being ill, the whole spectrum of response to having risk factors that goes from perhaps too much concern to not enough. And it is really, on both ends of that, something that's difficult to work with. But then that's what physicians are here to do.